Hello, friends. Welcome back to Learning Nails and Aesthetics. We are in the Milady Aesthetics book, Chapter 5, Skin Analysis. We will be reading from page 177 to 188. Keep in mind, I am not AI. I say this in every single video. Mistakes will be made. You can just laugh along with me. We will learn this together. I hope this is helpful to you. Please comment, like, share, subscribe. You know the drill. Get to work. Describe healthy habits for the skin. Top 10 healthy habits for the skin. 1. Avoid sun exposure. Use sunscreen daily. 2. Eat a balanced diet. 3. Do not smoke. 4. Avoid excessive alcohol. 5. Drink plenty of water. 6. Get plenty of rest. 7. Stay active and exercise regularly. 8. Use beneficial skincare products and a regular home care routine. 9. Get professional skincare treatments to maintain the results of your home care regimen and to more effectively treat the signs of aging, blemishes, and other skin conditions. 10. Implement stress relievers and maintain a calm, positive attitude. Check in. What are 5 healthy habits for skin? Determine treatment, contraindications through evaluation, analysis, and consultation. Certain treatments and skincare products may be contraindicated for a particular client, and it is your responsibility to evaluate the appropriateness of treatment and skincare products after your skin analysis and review of the client's medical history. These contraindications are factors that prohibit a treatment from being performed or the use of certain skincare products being used on a client's skin. Certain treatments could cause harmful or negative side effects to those who have specific medical or skin conditions. Communicable diseases, skin disorders, and medical conditions, medications, and skin irritation can all contraindicate or prohibit a service or use of a skincare product. The client must list a communicable disease on the client questionnaire. Recognizing diseases is vital to avoid causing harm to clients or to you. Medications or topical exfoliating agents may make the skin too sensitive for facials or waxing. Certain medical conditions, illnesses, and diseases such as cancer may contraindicate any stimulation to the face or body. Allergies and sensitivities to skincare products must be evaluated. Clients who have obvious skin conditions such as open wounds, cold sores, herpes simplex, or other abnormal looking conditions should be referred to a medical provider for evaluation and approval for aesthetic treatment. Contraindications are also discussed in other chapters. I've said it before, I'll say it again. Don't ever diagnose any clients. Don't tell them that you believe they have this or that. It can get you in a lot of trouble. Alright, contraindications for skin treatments. Certain skin diseases, disorders, or irritations must be considered individually based on the client's overall health. Use of isotretinoin. The client must have completed isotretinoin 6 months prior. Skin thinning or exfoliating topical medication, including Retin-A, Renova, Tazoric, Differin, or other forms of vitamin A. Avoid waxing, exfoliation, and peel treatments for a minimum of a week. Pregnancy. No electrical treatments, chemical peels, or aggressive ingredients without the client's medical provider's written permission. Some pregnant clients may experience sensitivities from waxing. I would like to add one of the big things for pregnancy, absolutely no salicylic acid. I'm sure they will go into that here. Metal bone pins or plates in the body. Avoid all electrical treatments in the area where the pin or plate is located. Medical professional consent is needed prior to treatment. Pacemakers or heart irregularities. Avoid all electrical treatments that require a grounding pad. Allergies. Any allergic substances listed on the health history form should be strictly avoided. Become knowledgeable about ingredients. Clients with an allergy to aspirin should not use products or have treatments with salicylic acid. They are both derived from willow bark. Clients with multiple allergies should use fragrance-free products designed for sensitive skin. Seizures or epilepsy. Avoid all electrical and light-based treatments that pulsate. Medical professional consent is best prior to treatment if the client has a history of seizures. Use of oral steroids, cortisones, such as prednisone. Avoid any stimulating, exfoliating treatments or waxing, as skin may be more fragile and bruise easier until the client has been off medication for a minimum of 2 weeks. Autoimmune disease, such as lupus, vitiligo. Avoid any harsh or stimulating treatment or skincare products. Approval from a doctor. Diabetes. People with diabetes who do not have good control of their insulin levels will experience slow healing. If people with diabetes are experiencing neuropathy, nerve damage to the extremities, they may not feel pain in the affected area. If you are in doubt, get approval from the client's medical provider before treatment. Blood thinners, including NSAIDs. Use caution when performing extractions or when waxing. NSAIDs are non-steroidal anti-inflammatory drugs. Over-the-counter medication used to reduce inflammation, such as ibuprofen. Client consultations. A thorough client consultation is important for many reasons. The most important is to determine that a treatment is appropriate for the client or the skincare product will benefit the client's skin. A consultation will help you to determine why a client may be unhappy with their skin or appearance. Health, lifestyle, occupation, and more affect the skin. Some estheticians are like detectives, trying to determine why the client is having a certain skin problem. The more you know about your client, the more you can make appropriate recommendations for skincare and treatment. Reminders on how to prepare for the client consultation. As learned in Milady Standard Foundations, which I have videos on that book as well. I have completed that book. Check those out. It is important to be prepared to facilitate the consultation process. You should ask yourself the following questions. 1. Is the client comfortable? You're about to begin an important conversation with them that will clue you into their needs and preferences. 2. Is your work area freshly cleaned and uncluttered? 3. Are all other appropriate tools to perform the desired service ready for use? 4. Do you have a pen or laptop or tablet along with vendor supplied or salon manufactured pamphlets, photos, articles, or clinical research papers? These items will help you to present the service or explain the benefits of certain ingredients that will be used to perform a treatment. 5. Do you have step-by-step photos of the actual treatment process? Photos can be helpful in letting clients know what to expect. If you have a satisfied client whose progress is significant, it is extremely important to gain their permission to use such photos for promotional purposes. 6. Will you be able to discuss whom the best candidates are for specific treatments to help decide if the treatment is suitable for a client? Forms. You should have at least 3 forms for a new client. An intake form, also called client questionnaire, health history form, or consultation card. Clients should complete a confidential intake form that should be updated at each visit. The form discloses the client's health history, all products and medications, medical conditions, any known allergies or sensitivities, along with their at-home skincare program and skincare treatments the client has recently received that could adversely affect treatments. Information should also include important details about the client, including their name, age, then they say that's optional, occupation, diet, and lifestyle habits. Refer to Figure 5-11 for a sample intake form. So I will read through this intake form, client intake form, and medical history. In order to provide you with the most appropriate treatment, we need you to complete the following questionnaire. All information is confidential. Date, name, date of birth, and then they say that's optional, email address, street address, phone number, occupation, how were you referred to us, medical history, are you currently under the care of a physician for any reason? If yes, for what? Then there's history, and they're supposed to mark a yes or no, and the date, and any additional comments. List all medications, supplements, and vitamins. List allergies. Accutane, antibiotics, birth control pills, hormones, aspirin, ibuprofen use, Retin-A, tretinoin, Metrogel, Metro cream, glycolic acid on a regular basis, antidepressants, sun reactions, medication allergies, food allergies, aspirin allergies, latex allergy, lidocaine allergy, hydrocortisone allergy, hydroquinone allergy, diabetes, smoking history, cold sores or herpes, bleeding disorders, autoimmune HIV, pregnant or planning to be, a pacemaker, implants of any kind, dental, breast, or facial, migraine headaches, glaucoma, cancer, arthritis, hepatitis, thyroid imbalance, seizure disorder, active infection, radiation in the last 3 months, skin conditions, acne and melasma, tattoos, permanent makeup, and microblading, vitiligo, keloid scarring, skin laser treatments at another office, if so, when, and what were the results, as well as Botox fillers, hair removal, chemical peels, sun exposure, tanning bed in the last week, or a self-tanner. List medical issues not listed above. Next section, current skin care and lifestyle. How do you wash your face? Do you use soap or a cleanser? If soap, what brand? If a cleanser, what brand? Do you use a moisturizer? Yes or no? Are you on a special diet? Yes or no? If yes, please specify. Do you consume water daily? Yes or no? If yes, how much? Do you drink coffee, tea, or soda daily? Yes or no? Coffee ounces, tea ounces, soda ounces. Do you exercise? Yes or no? If yes, how often? Have you ever had a facial? Yes or no? If yes, when was your last facial? Do you give yourself facials at home? Yes or no? If yes, how often? List additional cosmetics and skincare products you are currently using. What is the primary reason for your visit today? Select all that apply in the list below. I am concerned about facial or body hair and would like information on ways to get rid of it. All of these listed have a box for them to check or not. I'm concerned about fine lines around my eyes. I'm concerned about scowl lines when I frown. I'm concerned about pigmentation or age spots. I'm concerned about broken capillaries on my face or spider veins on my legs. I'm concerned about skin laxity and sagging. I'm concerned about the lines around my mouth. I'd like more defined lips. Other, please list skin concerns below. I certify that the preceding medical, personal, and skin history statements are true and correct. I am aware that it is my responsibility to inform the technician of my current medical and health conditions and to update this information at subsequent visits. A current history is essential for the provider to execute appropriate treatment procedures. I have signed the consent form for this procedure. I had the opportunity to ask questions prior to the treatment. I accept arbitration as a means of resolution for practice liability. Then there's a line for the client's signature and the date. Figure 512 is the client consent form. I hereby consent and authorize, and then there's a blank for the esthetician's name, to perform the following procedure. Then there's a line to fill in what procedure. I have voluntarily elected to undergo this treatment procedure after the nature and purpose of this treatment have been explained to me, along with the risks and hazards involved. By, and then there's a blank for the person's name, whoever explained it to them. Although it is impossible to list every potential risk and complication, I have been informed of possible benefits, risks, and complications. I also recognize there are no guaranteed results and that independent results are dependent upon age, skin condition, and lifestyle, and that there is a possibility I may require further treatments of the treated areas to obtain the expected results at an additional cost. I understand how important it is to follow all instructions given to me for post-treatment care. In the event that I have additional questions or concerns regarding my treatment or suggested home products, post-treatment care, I will consult, and then you're supposed to put your business name in there immediately. I have also, to the best of my knowledge, given an accurate account of my medical history, including all known allergies or prescription drugs or products I am currently ingesting or using topically. I have read and fully understand this agreement and all information detailed above. I understand the procedure and accept the risks. All of my questions have been answered to my satisfaction, and I consent to the terms of this agreement. I do not hold the esthetician, whose signature appears below, responsible for any of my conditions that were present but not disclosed at the time of this skincare procedure, which may be affected by the treatment performed today. Then there are places for them to print and sign their name with the dates as well as the esthetician. Service record. Date, client name, specific concerns being targeted, changes to health since the last visit, yes or no, photos taken, yes or no, type of treatment, settings, client skin type, circle one number. Number 1, fair, this is the Fitzpatrick Scale. Fair, always burns, never tans. 2, light skin tones, can burn, sometimes tans. 3, medium to olive skin tones, tans easily. 4, light brown to medium brown skin tones. 5, brown, moderately pigmented skin. 6, dark brown, black skin tones. Then there is a space to write notes as well as contraindications, and a record for in-office treatment recommendations for today and in the future. Home care instructions were given, yes or no. Recommended home skincare products. Product type AM products, getting ahead of myself, and PM products, and if they purchased products, cleanser, toner, exfoliant, serum, a mask, protection, eyes and lips, moisturizer, sunscreen, and other. And skin assessment and analysis. Several columns of conditions with a box for them to mark if they have these or not. Acne breakouts, keratosis, aging, asphyxiation or lacking oxygen, comedones, open or closed, cuperose, cysts, dark circles, dehydration, enlarged pores, erythema, fine lines, growths, hirsutism. Yeah, that's that one word. Gotta work on that one. Hyper or hypopigmentation, hyperkeratinization, hypertrichosis, keratosis, mature, melasma, milia, moles, oiliness, papules. Here's another one of those words. Poikiloderma of civet. Work on that one too. I'm sure it'll be in the glossary. Pore elasticity, puffiness, pustules, redness, rhytides, rosacea, scarring, sebaceous hyperplasia, seborrhea, sensitivity, stretch marks, sun damage, telangiectasia, and other. Then it says acne, and for boxes to mark for 1, 2, 3, and 4. Skin types: dry, normal, combination, oily. Skin texture: thin, thick, medium. Complexion color: pale, pink, olive, sallow, suntan, or other. Pigmentation: even, uneven, birthmarks, heavy freckling, some freckling. Muscle tone: good, fair, fallen. Rhytides: deep wrinkles, crow's feet, fine lines throughout the face, broken capillaries, nose area, cheek area, chin area, nose, forehead. Well, I guess nose and nose area are kind of two different things. It's odd. Diet concerns: UV exposure concerns, stress concerns, and then the esthetician's signature and date. Consent form. Also referred to as to consent to treat release. A customary written agreement between the esthetician and the client for applying a treatment, whether routine or preoperative. The client reads and signs the document, acknowledging that they understand what is being done to them as well as the risks involved in the treatment and releasing you from liability before you perform services. Client chart or service record card: a record of all your notes from the skin analysis, the type of treatment performed, products used in the treatment, goals you are working towards, your home care recommendations, and other consultation notes. This information will be needed for future visits. How to use the client intake form. The client intake form should be mentioned the moment a new client calls the skincare salon or spa to make an appointment. When scheduling the appointment, let the client know that you and the salon will require some information before you can begin the service. Some salons ask clients to arrive 15 minutes before their appointment time for this purpose. You will also have to allow time in your schedule to conduct a 5 to 15 minute client consultation, the verbal communication with the client to determine desired results, depending on the type of service you will be performing and the client's needs. Some schools or facilities ask clients to sign and date the intake form, especially when more advanced procedures are involved, while other facilities use the consent form for this purpose. How to use the consent form. When introducing the consent form to clients, take time to review all the steps involved in the treatment process. Be sure to carefully explain any home care directions that may be necessary. Provide the client with a copy of the consent form and keep the original for your files. It is also wise to maintain a treatment log and have the client initial and date all subsequent treatment procedures. These extra precautionary measures go a long way in safeguarding both you and the client. Questions to ask during the consultation. Common questions include the following. What is the reason for your visit? What brought the client in? Is it for a treatment or just relaxation? What are your skin concerns? What are they bothered about? What are your skincare goals? Are you preparing for a special event? When is it? Nosy. What is your home skincare routine? How many products does the client use at home? What are the ingredients and how often are they used? Have you had treatments before? Is this the client's first treatment of this type? Do you have allergies to products or scents? Is this a normal state for your skin? Is it normally clearer? Is it usually less irritated? How does your skin feel during the different times of the day? What is the degree of oiliness or dryness? Do you wear sunscreen? What is the SPF value? Tell me about your diet. Do you eat a healthy diet? How much processed food do you eat? How often do you eat out? How much water do you drink? What is your activity level? Are you often outdoors? Do you smoke? Any other allergies? How stressful is your lifestyle? Are you under a lot of stress right now? Have you had any aesthetic procedures prior? How long ago? Are you happy with the results? The skincare consultation and skin analysis is your moment to make the client aware of what you note about their skin condition and what services or products you offer that could benefit them. The consultation is also a marketing and educational opportunity to introduce services and products to the client. Once you learn about ingredients and start performing skincare treatments, you will be recommending products. Think about how you can help the client through treatments, home care suggestions, and preventative measures. Conduct the consultation, discuss what you see with your client, and give recommendations during the analysis or after the treatment. It is beneficial to practice skin analysis before diving into products and treatments. Each subject you study gives you a foundation to build upon the next step. Check-in. List 6 contraindications for facial treatments. What 3 forms are needed for interaction with a client? List 8 questions you would ask a client during a consultation. And that is the end of today's video. Check out my other videos. And I hope this was helpful to you. I appreciate you watching. Please comment, like, share, and subscribe. I may go through the books and we'll review all the check-in questions in each chapter with the answers, of course. We'll do that in future videos. Next video, we will be reading from page 188 to 195 in chapter 5 of the Milady Aesthetics book, Skin Analysis. Then that will be the end of that chapter. Yes, I believe so. So, thanks for watching. Have a great day. I hope this was helpful. Okay, bye.